Sì, 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 ma vabbè, ma comunque... Bene, buongiorno.
Good morning, ladies and gentlemen, and welcome. Welcome to this international arena, Cooperating Italy. So this is the 6th edition, and the Ministry for Foreign Affairs and International Cooperation decided to have this moment of exchange. I am Biagio di Terlizzi, and I am the Deputy Director of the Mediterranean Agronomic Studies in Bari. It's an intergovernmental entity providing training for executives and managers. And then it was also involved in the research and cooperation sector. So the Bari chapter is now focused on research and cooperation and tries to develop cooperation in several countries, and in particular trying to further strengthen the relationships already established by the Ministry for Foreign Affairs and for International Cooperation. So we are here to have a further look about the Italian system. So we are here to see how several international institutions try to promote Italian initiatives in the field. So in particular, the main goal is to achieve the Sustainable Development Goals of the Agenda 2030. And originally, Mr. Stefano Gatti, the General Director for the Cooperation for Development, was supposed to moderate this meeting, but couldn't. And we're also waiting for our minister, the Minister for Foreign Affairs, Mr. Tajani. But still, in the meantime, we are about to start. So I would also like to thank the Rimini Meeting Foundation for promoting such opportunities of dialogue. And in Bari, we are very active, and we try to work with young people coming from 15, 18 countries, and they usually come to Bari and stay there for at least 2 years. And we have an international campus, and we had people also from the Balkanic area during the war in that area, and I must say that we never had a single problem. So we are animated by a truly international spirit, and we're very happy to be here to talk about our experience. And now we are going to focus on food and health in Africa. These are two things that need to go hand in hand. So we have representatives of the CUAMM, Mr. Dante Carraro, who is the director of this NGO, and who is accompanied by Dr. Kakala. And also we have the director of Save the Children Italy. Why are we here today? Well, for different reasons. We always talk about food security, and food security is at the center of the Italian strategy. And in particular, we decided to set up a specific office dealing with this. So within the General Direction for Cooperation for Development, a specific department for food security was established. On top of that, we have decided to talk about food and health because at the end of January, our Prime Minister Meloni launched a very important plan, the Mattei Plan. And the Mattei Plan covers 6 different sectors, so education, agri-farming, health, energy, water, and physical and digital infrastructure. So 6 major sectors for Africa. Today, we want to combine agriculture and health, and so these are two key elements of the Mattei plan, and so we're going to see how they can go hand in hand. On top of that, we keep talking more and more about sustainable agri-food systems. We need locally oriented supply chains, but also we need to keep an eye on environmental protection. So we need to improve not just the quantity, but also the quality. That is why when it comes to nutrition, there are strategic challenges. And we're going to understand why, unfortunately, when it comes to some countries, they are not considering this nutritional aspect. But they are not doing that because they do not consider that important, but because there are specific conditions changing the local lifestyle. And this has an impact then on nutritional habits and styles. A third reason to talk about these two topics is that a sustainable agri-food system is essential, but this is not enough. We also need hospitals. So we are going to see to what extent healthcare services and health-related issues can go hand in hand with agri-food and food security policies. But let's go back to the Sustainable Development Goals that are strictly connected to such topics. So we're going to see to what extent many Sustainable Development Goals are covered by these topics. In particular, goal number 8, decent jobs and economic growth, together with goal number 13, so fight against climate change. And goal number 3, so 8, 13, and 3, improvement of health care facilities. And then we also have covered the goal number 2, promoting food security. So we have many cooperation initiatives that sometimes are focused around just one sustainable development goal, but here you see we have 4 SDGs that are covered. And in particular, when it comes to the One Health strategy, this is a very important principle, because this principle entails the health of people, the health of the environment, the health of animals. And let's not forget that apart from the health of these 3 major ecosystems, we also need to guarantee the safety of people and workers within these 3 ecosystems. So we need to be human-centered, especially when it comes to the One Health principle. But again, this is such a multifaceted topic, because even food can be healing, and also farming can be healing. We have the healing agriculture. So we have sustainable farming methods that can lead to a high nutraceutical and nutritional content of foodstuffs in order to prevent health issues and problems. And then last but not least, so food, nutrition, and diet, 3 key pillars that are strictly intertwined. So diet is key in order to prevent chronic diseases such as cardiovascular diseases, and in particular we are going today to see more about cardiovascular diseases on top of metabolic diseases such as obesity and diabetes that certainly pose a major threat. This morning I was listening to a podcast about obesity, and I learned that somehow sleeping with the light on seems to be conducive to obesity, because it seems to favor weight gain. So this is pretty interesting. In Africa, maybe people tend to, I don't know, to sleep with light, but I frequently go to Egypt, and I can tell you a story. Before the elections of the current President al-Sisi, those who used to go to Egypt saw huge posters of triple hamburgers. So a hamburger with somehow 3 patties of meat. And so you could see all posters all over the place. But then one day they disappeared, they vanished, and the photo of President al-Sisi magically appeared, replacing these triple hamburgers pictures. And it was appearing as a candidate. So sometimes food habits can be influenced also by advertisement. And certainly there are countries, even in Africa, where there are obesity problems, as it is the case in Egypt.
Quindi la parola alla direttrice.
So I will now shut up and give the floor to the director of Save the Children Italy, Daniela Fatarella. And she has been working there since 2004. Before, she was the fundraising and marketing director of Greenpeace, then national director of the Christian Blind Mission. She's a marketing communication expert, or she's also an expert in strategy and planning. So she has been working in the international cooperation sector for 25 years. And you are present in many African countries, and so you have to face several problems when it comes to malnutrition and poverty. And in some countries, you also have very high rates of even 45%. And often, many very young children suffer from development-related problems. So, what is your take when it comes to the work of Save the Children in African countries in order to fix these problems? Thank you, Biagio, and good morning, everybody. I'm very happy to be here. I'm the General Director of Save the Children Italy. Save the Children is an international organization working in more than 148 countries in the world. We are the largest NGO in Italy and also the largest international NGO dealing with youth rights. And as Biagio said in his introductory words, there is a direct connection between food security and healthy food habits and lifestyles and children's health, in particular in female children. Why? Well, because food and nutrition have a deep impact on their development and on their future, because a malnourished child that has not access to the right caloric intake or to an excessive caloric intake can certainly be a deprived children that can then experience heavy consequences in their future development, and that will have a very, very heavy impact on their young years and also on their adulthood. So they should have access to right nutrition. But we work a lot in Africa, and we see that sometimes there are conditions that somehow prevent people from having a healthy diet, because conflicts, climate change, economic crisis, high prices somehow make it impossible for people to have a nutritional diet and reach also the Sustainable Development Goals that also include zero hunger. But that would mean that all people can have access to a right nutrition. So I just want to give you a couple of figures that are extremely important and meaningful. We have 37 million children in the world below 5 years of age that are overweight. Many of them are in developing countries or low or medium income countries. In Africa, we have 64 million of children below 5 years of age that instead are malnourished. So they are on the verge of hunger. We know that there is a double effect when it comes to the consequences of such malnutrition. What do you see in developing countries? This is a very frequent question we are asked. Well, you see a lot of things, but I want to share a recent experience I had in Malawi last July. I visited many Save the Children projects, in particular one in the Zomba province in the south of Malawi. Malawi has a very high range of people living below the poverty threshold. Save the Children strictly works with local communities in order to foster projects fostering economic resilience. And what does this term mean? Well, that means that communities should be economically sustainable. That means having a suitable nutrition, not just for children, but for entire communities. We also monitor the results of such projects because then we would like to have good practices to be scalable in other areas. So basically, we try to identify economic activities and systems likely to generate income within the community, and also we try to make these communities resilient in case of climate disaster. So in case of drought or flooding, these communities should be able somehow to resist and not to be completely disrupted and maybe annihilated or destroyed. So on the one hand, we need deep studies of such communities in order to better understand the needs, the specific needs of each household. So we need complete studies to understand the current situation, to have a snapshot. Secondly, we need to work with local communities because local communities have a deep knowledge, not just of the local areas, but also of the animal farming activities, the farming activities. So combining their skills and knowledge with the skills and means of Save the Children, we can certainly identify solutions that may seem simple, but actually they are life-saving or life-changing, so they can lead to radical system changes. For instance, we have integrated farming systems. That means that inside households you can have communal vegetable gardens or small animal farming activities, providing enough nutritional food for communities. And in particular, women are involved in order to train them, inform them about nutritional foodstuffs, how to cook them. So we also had cooking sessions. Sometimes it is pretty easy because you can make use of already present local foodstuffs that are not simply used, but instead such foodstuffs can lead to nutritional food habits, not just for children, but also for entire communities. This can lead to cultural change, habits change that can then lead to systemic changes. And again, a very interesting thing is that we saw how such practices can be then embraced fully by communities. For instance, I remember a lady showing me what she was preparing for her son, and I asked her what was she thinking about the project, and she said, well, to her it was not just a project, but it was really something that had changed the food habits and practices of a whole community that had led to radical and important changes also in farming methodologies and animal farming methodologies. So that means that those methodologies will remain in those communities, and this is the major change that then should be made scalable, and this is the final goal of international cooperation projects, because it's about small steps that can lead to major changes and that are sustainable and are scalable, so they can be replicated elsewhere. And starting from the local level is what makes the difference. Daniela. You are very active in Africa, but do you also do something similar in Italy? Well, certainly in Italy, we do something that is about healthy lifestyle. And so in Italy, we see the opposite. There is an increase in overweight children and also in children affected by obesity. Sometimes it's easier to find cheap food that is very rich in sugar, fat, that are extremely energetic, that are very easy to be found and are also very cheap. So in particular, low-income households tend to buy such low-quality foodstuffs, promoting then such a bad diet for young people. So instead of promoting health diets and health habits, including physical exercise, well, they don't do that. And this is a global trend. From 2020 to 2022, there was in Africa a 23% increase of children below 5 years of age who became obese. So what are we doing in Italy? So we try to work within educational areas, within schools, and also we try to work on healthy life habits. This means training, raising awareness, informing, educating, not just the kids, but also the parents. And very easy activities can be done. So, for instance, going with mothers to the supermarket to see what they can find, also local cheap products that can be bought and cooked. And we know in Italy more than elsewhere that food gets people together. So when it comes to cooking and kitchen-related activities, so that becomes a relational element. We welcome many kids with migratory backgrounds with their families, and so we can make world tours through their cuisines, and also we can learn more about nutritional foodstuffs coming from other cultures, and that becomes a mean of integration and development. So actually food and nutrition and diets get people together, because we should promote healthy habits everywhere. And so we range from areas of the world where some things are lacking to areas of the world where other things are excessive, but the main goal is to identify healthy life habits, healthy food habits, and in particular we try to help people find local affordable products that can lead to healthy food habits. Thank you, Daniela, and congratulations, and all the best for your future work. So you were mentioning some activities, and so you mentioned farming. So what can be done when it comes to farming? Well, we also try to promote the use of varieties that have been forgotten, maybe because of life habits changes, or maybe because colonization in the past led to single crops farming, and that later on brought about health-related problems. So these crops, these forgotten crops that are underutilized or non-utilized, they are called orphan crops because nobody takes care of them. So our goal is to revive them and somehow to promote their use again. We have many of them, especially in the Sahel areas. But it is also important to know how €1 can allow a family to have a meal. If we can make that euro be used for nutritional, healthy foodstuffs, well, then the goal is achieved, because a single euro can lead really to a big change. And then if we also promote the use of energy sources that are not going to create intoxicating-like situations, like excessive smoke, really we are going to promote an environmentally friendly lifestyle also in those countries. So this goes back to biodiversity. Biodiversity needs to be safeguarded. Communities need to be safeguarded because these communities are frail, but we need to support them in order to make them more resilient, also with respect to natural disasters. But now let's talk about another organization that did a lot in Africa. Is the CUAMM. So I give the floor to Don Dante Carraro. He's a physician, a cardiologist, but also a priest, and he has been working with these medical NGOs since 2008, and he tries to promote health in African populations. So he travels often to Africa. So he constantly travels between Padua and Africa, and he joined really many projects, also with many voluntary workers. So we talked about cardiovascular diseases, so non-communicable diseases, and then diabetes. And usually these are provoked by unhealthy food habits and life habits. In some areas during the rain season, you can have corn, but also other crops. Corn is used because corn provides carbs, but during the rain season, the other crops are sold, and the revenues do not reach households, but this money is used to buy Coke, so a soft drink, or other things like that. But during the dry season, corn is kept as meal, as flour. It is used as a foodstuff, but also corn is fermented in order to produce alcohol for them, for adults, but also to give them to children in order to make them feel sort of full, so that they can sleep and do not feel hunger. This is what happens between these two seasons, the rain season and the dry season. So Don Dante, we would like to know more about your activities in Africa, and what is your take on this commitment to prevent non-communicable diseases?
Thank you. So this is the map of Africa. And you see where we are operating. We're only working in Africa. CUAMM is only working in CUAMM. We're not working in Northern Africa. It is a different world compared to Black Africa. In terms of systems, infrastructures, in terms of healthcare expenditure. It's a totally different world, just like South Africa and Namibia. They are totally different. Basically, we are focusing on sub-Saharan Africa, where there are two types of countries. On the one end, poor countries, and on the other, poor and frail countries. In terms of literature, they are called fragile states. And I'll give you some examples. Uganda. Yesterday, we had the Prime Minister with us, and Kenya and Tanzania, as well as Mozambique, are poor countries. What do I mean by poor in terms of healthcare? They are countries spending $40, $50 per head every year for healthcare. In Italy, we are spending $3,000 per head every year for healthcare. So they're really poor countries. And then there are countries which are poor and fragile. So they have healthcare systems with no structure at all, where you don't understand the different the levels of the different hospitals. You don't understand where health centers are, like South Sudan, the Congo, Sierra Leone, poor countries which have no structure at all. So I'm making this difference because undoubtedly the need for prevention, as told by Daniela and as told by Biagio, the need for investing in communities so that the families can have access to some types of food is something that you can work on in poor countries which have some structure. And I'll give you some example. We have Dr. Bernard with us. He comes from Tanzania. The little crosses are the different hospitals. There are not many crosses in Tanzania, and in Uganda we have many more in South Sudan and in the Central African Republic. So we are working in poor countries like Tanzania and Uganda, and we are investing more where there is no structure, like South Sudan or the Central African Republic. So countries like Tanzania are poor countries, but they have a structure. For example, Dr. Bernard, he will tell you about it, comes from this region of the Central South. It's the Iringa region. Maybe some of you will know this region. There is a hospital, and that hospital, like in other poor countries, has some health centers and communities, local communities. The Tosamaganga hospital has 12, 13 health centers, and then there are also the communities. And the work has to be done at the level of the community in order to prevent chronic diseases. And I'm thinking about hypertension and diabetes in particular. With Biagio and Daniela, we're thinking on how to make it possible for a hospital that last year managed 1,500 patients suffering from hypertension and diabetes. So how we can help the local communities to have a more healthy diet. and to grow local crops. Hence the importance of CIAM in Bari, because they know about land, what lands can produce and what they cannot produce, so that we can avoid mothers just to give sugarcane to children. Whereas the other food must also be provided that is more nutritional. Sorry about that. So we have to work a lot on the chain around the hospitals. So hospitals, communities, and health centers. We have to invest significantly in local communities. This is what we're trying to do, because the problem of diabetes and hypertension can be solved in 90% of the cases by working in local communities. Hence, the importance of agriculture and of providing more healthy food in order to prevent those diseases. Then, in 10% of cases, it is bad luck, because there is type 1 diabetes and type 2 diabetes. Type 2 is for adults, which develops over the time, and treatments need oral pills, mouth pills, which are cheap, and a lot can be done on prevention with a healthier diet, with a more balanced diet. And here the big multinational companies are responsible and are liable, because Africa is developing these diseases because chips and soft drinks, which are very colorful, and I was in love with those colorful soft drinks that I used to drink 50 years ago. That does no longer exist here in Italy, but that exists still in Africa. Unfortunately, there are multinational companies pushing a lot on soft drinks, and this has developed type 2 diabetes, which can be prevented. And then you have type 1 diabetes affecting children. Daniela didn't talk about it. Children lacking insulin, and insulin has to be given, and unfortunately diet is not enough in that case. So in Africa, these non-communicable diseases, diabetes and hypertension, are increasing significantly compared to some years ago. There is an epidemiological transition underway in Africa, as in 20 years ago, people like us working in Africa were concerned with tuberculosis, HIV, infectious diseases, as well as cholera or typhus. And that was a major problem. Together with infectious diseases, there is an epidemiological transition where chronic diseases, as in diabetes and hypertension in particular, are booming. Tanzania, I'll just give you a number, from 2.8% of prevalence in diabetes has now reached 12%. Over 10 years, diabetes has increased by 10% in the overall population of Tanzania. So it is booming. In Mozambique, up to 10 years ago, the Ministry of Health of Mozambique didn't have guidelines on the prevention, diagnosis, and care of chronic diseases, diabetes and hypertension. There were no guidelines, and that was the Ministry of Health. Today, together with the local Ministry of Health, we have drafted guidelines applied to the country for the prevention, and the prevention is related to the work done by Daniela, and with CIAM we'll be working on that, because the system consists of hospitals, communities and health centers. Unfortunately, fragile countries cannot face this problem because they have no structure at all, and it is impossible to work there. So, you are engaged not only on non-communicable diseases, you are providing assistance to local community in a global way. How are you helping the local community? How is CUAMM helping the local community? And how are you taking up the different challenges? Someone is asking me always what we do in Africa. And what I say usually is we support 21 hospitals scattered all over the continent. Okay. But the hospital is, let's say, the core of an overall system made up of communities and health centers. Different things have to be done in different ways in the different places. So the whole work is precious, especially what the CIHEAM is doing, because the CIHEAM is studying the land, what crops have to be grown. We have to avoid single crops. In Tanzania, a lot of land is exploited by multinational companies, whereas land diversification is important. At a community level, you can do three things. Vaccines, control of pregnancy, and control of weight and height for children for malnutrition. Then we continue working on land, maternal education, nutrition education, what is dangerous and what is not dangerous. This is the community. In the healthcare centers, we can provide a treatment for a pneumonia, for dysentery, for children who are underweight. And when the situation is very critical, then there is the hospital. So in the health center, it is, and in the community level, it is important to work to control malnutrition, vaccines, and pregnancies. But together with that, there is work on education, training, and we have to study what the land can do in order to prevent these diseases. Thank you. Everything seems to be very easy. So we can make crops, we can create the fields for schools, hospitals, but the problem is how can we manage all that? Are local entities able to manage things? This is the great engagement, and this is the debate that we have to do in those contexts which are fragile and which need to be helped. Okay. So you've been mentioned before, Bernard Kakala. Since 2021, you have been a doctor working in the Iringa region. So tell us something about Tanzania. As far as we know, through your work, Tanzania has been made aware. The Ministry of Health has been working on guidelines for the prevention of non-communicable diseases. So it is important to have an impact at the institutional level because we must create a dialogue between the central system, the institutions, and the community so that the government can listen to the community. This is what we do for development cooperation. I give you the floor, Bernard. Tell us something about what you do in this hospital and in the health care centers. The floor is yours. Tosamaganga Hospital, right?
Okay, thank you everyone, especially the organizers of this conference. So I'm from Tanzania and we are working in the NCD clinic. So maybe we can know what is NCDs, because this is the main challenge. Many people don't know about NCDs. So these are the diseases which cannot be transformed from one person to another, but they are largely caused by unhealthy diet. And about 80% of these diseases can be prevented just by lifestyle modification. So we have like 4 main groups of non-communicable diseases, which comprises about cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. So in Tanzania, non-communicable diseases comprises about 41% of total death and disability. You can see how bad it is. And as Dr. Dante said, diabetes, according to the research in 2011, the prevalence was 2.8%. But 10 years later, the prevalence rises to 12% and makes Tanzania the highest country with many number of diabetes. So due to this increases the number of patients in Tanzania, also in Iringa, and especially in my hospital, we came with this approach to start the non-communicable disease clinic. So the clinic began in October 2016, and until now we have enrolled a total of 2,226 patients with hypertension and type 2 diabetes. So majority of these patients, about 75%, they are female, and about 70% they are hypertensive, 15% are diabetes, and another 15% have both pathologies. So what we are doing normally in the clinic, so we usually provide the clinical services, when the patient came, we took the vitals, and the patient will have the opportunity to see the physician. So after that, the patient will be treated. If there is any need of doing a laboratory exam, the patient will be sent to the lab, and after that, after review of the labs, the patient will be given medication. And all these services, they are all free of charge. And also we are providing health education. We have the aid of a nutritionist, which provide health education. But also we have 2 nurses experienced in providing counseling about health education. But also we extended the service to the health centers. Until now we are doing supervision in 9 health centers of the Iringa DC, by which we usually provide job training to the health staff in the health centers. But also we created a network of peer supporters. These peer supporters, they are patient but experienced and training about non-communicable diseases. And their role is to extend the knowledge to the community they are coming from, because the community is very big, so we need some people who can go and meet at least 1 people after another. So we have some challenges we are facing. And the main challenges we saw that is the lack of awareness, because people, they don't know what are the risk factors to getting these non-communicable diseases. But also, the distance is also a main factors, which under our observation, we saw many patients has a discontinuation of care because they are coming too far from the health center. And also there is lack of trained health personnel in the health centers, together with an availability of drugs. But at least for this project and the CUAMM, we have made at least we can fill the gap. Even for those patients who cannot pay, at least we are providing medication to them. So we due to this distance, we came with a new approach, which started last year in June, and we extended the service even to the health centers, because many patients came from the health centers, and the majority, they were not able to come to the hospital regularly. So we usually go to the health centers every month, and we are providing this health education and the normal clinical activities, but also every time before starting the clinic, we take a time to explain what is risk factors, how can we prevent it, especially on eating healthy diet, being physically active, like cutting down the use of tobacco and stopping the harmful use of alcohol. So now we have another approach by which we based more on the prevention, because we have seen that the trend has been rising. So we thought it is better to focus now on the prevention, even to those people who doesn't have these diseases, at least to prevent them from having those diseases or even the complication. So what we normally do, as I said, there is lack of awareness. So we usually provide this health education, and also with the network of peer supporters, at least we are able to reach the community. But also we are organizing like public event by which we usually doing mass screening about non-communicable disease together with treatment and counseling. And also this education, we also goes far. At least we can reach people, especially in the religious places, like in the church and in the mosque. And also we have a routine to organize like marathon, at least to encourage people to be physically active. So this is the main activities we are doing in the non-communicable diseases. Yes, for the marathon we started last year, and of course we had a very good opportunity, and the people were joined, were cooperative, and also we are planning to do it this year.
Ok. Dottor Bernard, potevi finire con un...
So, Dr. Bernard, you could invite us to the marathon. Why not?
I'm happy.
Grazie, indubbiamente, lei con piacere.
It will be a pleasure for us to come. Okay? Thank you very much for your contribution. Thank you very much to CUAMM and Save the Children. So we have to draw some conclusions. So hospitals and health centers can become centers for food education. Where good nutrition can be promoted in order to increase health. So, healthcare and agriculture. Sustainable development goals can be combined in that. So we have to use traditional products. We have to rediscover them because they have been forgotten, and we have to study them in nutraceutical terms. So let's support research. Research and cooperation must be combined. There can be no good cooperation without research on field. Let's not forget that we have to operate for local communities. As we said at the beginning, the One Health principle must be extended to the person. The person must always be central. A community consists of people. Other elements must also be considered when talking about Africa. We have to give the right value to food. Sometimes we forget that it is important to give the right economic value to food. Yesterday, the Prime Minister said that coffee production in Uganda gives a $2 earning per kilo of coffee to the people in Uganda, and it is sold for $30 per kilo in Europe. So there is a gap of $28 here in terms of earning, but there's a lot of work also that has to be done, roasting, selection, marketing. But the point is that we have to help with research those countries so that farmers are not just the ones doing the collection, but can also be included in the production process. So we have to give a higher value to the product grown by farmers. And we needed to diversify. We have talked about corn. We have to diversify with legumes and in beans, sweet potatoes, manioca, vegetables, fruits. This is also cooperation. So this means trying to change lifestyles. And let's also try to reduce waste, which to us is waste, but in Africa is a loss. And research must help us here, because food produced by farmers against the climate change, which is a major challenge, is not lost. Okay, thank you very much to all of you. I don't know whether there are questions. We'll be glad to answer your questions. Otherwise, enjoy the meeting and enjoy the different pavilions to see what Italy is doing in other continents, and especially Africa. Thank you very much to all of you for your attention.